Hey YouTube, my name is Lainey and I'm here to talk about 6 tips, not 5, but 6 tips on how to help ease your nausea while being pregnant. I am a new mama to a beautiful 7-month-old, and I knew if I were to make a YouTube video, it had to be about how to help ease your nausea while being pregnant. Why? Because I struggled big time with nausea during my first trimester. So I would say my nausea started around 7 to 8 weeks pregnant, and then it lasted all the way until my 14th week, which was a struggle. I think I speak on behalf of my husband and I, that was a trying time. So here I am to help give you some pearls on how to help ease your nausea while being pregnant. Tip number 1. Lemon water. I know you guys probably hear this all over the place about staying hydrated, but I don't know if you were anything like me. I hated drinking plain water while I was nauseated, and what do you know, just some squeeze of lemon, even maybe like a drop of honey, really made it palatable for me to drink and able to tolerate it more. And of course, when you're pregnant, you want to stay as hydrated as possible. So whatever I could do to get that water in. Tip number 2, eat often and small meals throughout the day. I know you probably hear this everywhere, but it is so true. Just eating small little snacks throughout the day, whether it was saltine crackers or a protein bar or a fruit salad, whatever it was, it just really helped. Just having my body digesting throughout the day helped ease my belly, but not only that, it made me feel better knowing that I was actually able to put some stuff in my body, because remember, you're not only feeding yourself, but you're also feeding your little baby. Tip number 3, eat what you crave. And I mean it. So while I was pregnant, I really listened to my body on what it was craving. So I usually eat plant-based, whole foods, things of that nature. But when I was pregnant, that all went out the window. Some days I was craving a Chinese takeout, and then some days, yes, I was craving a big, nice kale salad. And then some days that sounded terrible to me, and I craved pad thai. So I really just listened to my body, and let me tell you, that helped a lot with my nausea. And I'm telling you, these food aversions were very real while I was pregnant. So I really just listened to my body, and it definitely helped getting all the nutrients in that was necessary for me and baby. Tip number 4, go work out. Go outside, go for a walk. I know what you're thinking, that is crazy. That is the last thing I want to do, is leave my bed. Trust me, I was there. However, when I practiced what I call the art of showing up, getting to my elliptical in the garage, just putting in 20 to 30 minutes of some sort of physical activity, just made me feel so much better. Nonetheless, it made me feel human. So I wasn't hard on myself during this time. I typically have these really challenging workouts on a daily basis before I was pregnant, but I knew when I was dealing with this nausea during my first trimester, I just wanted to do what I was able to do. So sometimes that meant just 20 minutes, very slow, on the elliptical, and I was not hard on myself during that time. Tip number 5, peppermint. For some reason, everyone recommended me to eat all things ginger. Drink ginger tea, ginger drops, ginger chews. That did not help me out. I actually had a food aversion to ginger. So I was searching for all the things, and surprisingly, peppermint really helped me out. So peppermint tea, peppermint essential oils, I would just dab it right here because I was still working full time. So I would just dab it here, smell it in between patients, and it helped ease my belly. peppermint drops. I will put a link down below on the exact ones that I actually ate. They actually really helped a lot. All right, lastly, tip number 6. So before I give this tip, just a disclosure, please clear all these tips with your healthcare provider, and especially this last one, because it did involve taking some over-the-counter products, which these are the only 2 that I took while being nauseated. So my midwife recommended vitamin B6 and Unisom at night. So vitamin B6 would definitely help as needed when I needed it, when it got really, really bad. I would say I did not have the typical morning sickness. I actually either had my nausea throughout the day, or it would be very severe at night to where I would have a difficult time falling asleep. So I would take the vitamin B6 as needed throughout the day, and then I would take the Unisom at night when it got really severe and I couldn't get my sleep, and it did the trick. So those are my 6 tips on how to help ease or prevent your nausea while being pregnant. I hope these things help you as much as it helped me. And please know, give yourself some grace during this time. Your body is making a human being. It's making your little baby, and the stage is temporary. So give yourself some grace, and wish you the best of luck, mama. All right, until next time.